Okay, hi everybody. Today another session on ultrasonography of spleen. So this is as part of abdominal and pelvic ultrasound imaging. I'm Dr. Vibhu Sharma conducting the session, and so this is the spleen. As you can see anatomically, spleen is in left upper quadrant along the pancreatic tail. You can see the structure. This is just a diagrammatic representation. So what we'll be achieving by this session is we will understand the anatomy and function of the spleen. Then we will see about the ultrasonography of spleen, the procedures for splenic ultrasound, how the sonographic appearance of a normal spleen is there. Also, we will see some pathologies like splenic rupture and hemangiomas. So this is the embryological demonstration. You can see that the spleen arises from a mass of mesenchymal cells located between the layers of the dorsal mesentery, which connects the stomach to the posterior peritoneal surface over the aorta. So this is the spleen. Okay, this is developing from a mass of mesenchymal cells between the stomach and the posterior peritoneal surface over the aorta. So along the stomach, the spleen is there. So what happens is that the spleen is an intraperitoneal organ that occupies the superior posterior lateral aspect of left upper quadrant. It is normally in continuity with the diaphragm, contacts the kidney and splenic flexure inferiorly and stomach and tails medially. A tail of pancreas. The splenic artery arises from the celiac axis, travels along the posterior superior aspect of pancreas towards the splenic hilum, and it becomes tortuous with aging. Splenic vein exits the spleen at the hilum and initially travels superior to the tail of pancreas. The splenic vein is located slightly inferior to the splenic artery. So here you can see the location of spleen adjacent to the stomach and pancreas. So the pancreatic tail is the pointer marker for splenic localization. So mainly the splenic vein you can see arises and it is traversing through the splenic hilum. These are the short gastric veins, which are again at the level of splenic hilum. So the short gastric arteries are arising from at the splenic hilum, and this is the spleen, just above the splenic flexion, pancreatic tail. You can see the celiac arteries arising from the celiac splenic artery arising from the celiac trunk. So this when we cut open the spleen, you can see the spleen consists of capsule. You can see the artery and the vein. These are the trabeculars which are within the spleen. Then there is red pulp and white pulp. So and these are the vascular sinusoids within the splenic structure. So this is the hilar representation. You can see the posterior one, the anterior extremity. These are the terminal branches of splenic artery, and there is some notching along the superior border. So why are these vascular polyps important? So the splenic parenchyma appears very homogeneous on sonograms. It is echogenic than liver, and it's considered more echogenic than left kidney. So normal spleen measures around 11 centimeters. Transverse view thickness is around 4 centimeters. Longitudinal view of spleen you can see here, and the kidney shows that the spleen is considerably more echogenic. This is the longitudinal view of the spleen, in which the tail of pancreas, you can see the tail of pancreas, which shows that in the patient with spleen is less echogenic than the pancreas. So the measurement of the splenic size, so according to literature, the thickness can go up to 6 centimeters and the spleen can go up to as high as 13 centimeters. So there is internationally there is a cutoff of 13 centimeters, and normal spleen is crescent shaped. Small nodules of splenic tissue are often located in the left upper quadrant adjacent to the spleen, referred to as splenules, accessory spleens, spleniculi, and supernumerary spleens. And they are usually less than 3 centimeters, but can enlarge and become more evident when spleen itself enlarges or when spleen is removed. They tend to be round or ovoid and isoechoic to the spleen. Splenule is you can see these are the splenule. These are just accessory spleen. These are part of spleen only. Splenic tissue which is ectopic in location, and there can be vascularity which is arising from the splenic artery. So this is how the physiological sample of spleen looks. You can see various sinusoids within the spleen. Sometimes you can see a splenic cleft. Here in the longitudinal view, you can see a splenic cleft, which is very common. So this is how the subcostal approach is used for visualization of spleen in a right lateral decubitus or a right posterior oblique position. You should tell the patient to take a deep inspiration, and then you can go into the intercostal scan plane and you will see the spleen very clearly. This is how we should be along the axis of the spleen. Subcostally, we should check. So a large number of processes can result in splenomegaly when the spleen is enlarged, and you can see the transverse and the longitudinal diameter increases. So what are the main causes for splenomegaly? Are heart failure, portal hypertension, leukemia, lymphoma, hepatitis, mononucleosis, hemolytic anemia, general infection. Uncommon are glycogen storage disease, malaria, myelofibrosis. So the various cysts can come within the spleen, and most common splenic cysts are result from trauma. So it is a easily traumable organ localized in the left iliac fossa region, left upper quadrant region, and you can see a longitudinal view of the spleen showing a large anechoic mass here. There are no solid elements or there is no detectable enhanced through the transmission. So it is a simple cyst of the spleen. Sometimes they can have wall calcification or shadowing. That shows that these are old. Yeah. So sometimes you don't find a spleen. That condition is called asplenia. There is absence of spleen. Accessory spleen or splenules we just saw, they are typically around 1 centimeter in diameter, and these are mostly developmental anomalies or trauma. So splenosis is when there is the splenic tissue is ectopic in position, and there is spontaneous transplantation of splenic tissue in unusual sites. This is after splenic trauma or rupture. Acquired condition defined as autoimplantation or focal deposit of splenic tissue in various compartments of the body. Then there can be wandering spleen. The spleen is not localized in the normal position, it is ectopic. So that is when we call it as wandering spleen. Hemorrhagic cyst, when you see cyst with internal contents, you can see here debris and few echoes. Here septations are there. So these are all hemorrhagic cysts. And on cut section you can see the septations very clearly. Perisplenic cyst, and these arise from a various variety of organs adjacent to the spleen, and most commonly are pseudocysts. You can see these are perisplenic cysts. So they can be pelvic, perisplenic, perinephric, subgroup. Echinococcal cyst or the parasitic infections of hydatid disease are endemic, and usually people who raise sheep, they can have echinococcal cyst or the complex cyst. So typical appearance of a hydatid cyst, you can see multiple daughter cysts within the cyst appearance. Abscesses are common. You can see small abscess formation with multiple thick walls, complex cystic lesion, and more common in patients who are immunocompromised. This is the case of splenic abscess. You can see thick internal contents which in an enlarged spleen. So, and patient is having acute fever and all, then this is the case of splenic abscess. Vascular anomalies like splenic artery aneurysms can be there. You can see false pseudoaneurysms or splenic artery aneurysms. They are rare, but third most common abdominal aneurysm after aorta, iliac arteries. They may occur in pregnant women. In third trimester, rupture can cause a mortality in pregnant female. The risk is more than 50%, and risk include smoking and hypertension. So sometimes there can be splenic infarction, hypoechogenic bearing marked with a white arrow. Here you can see with the duplex sonography. there is no color signal from the ischemic area. So then we label it as splenic infarct. Again, examples of infarct: no vascularity within these hypoechoic areas. Splenic granulomas. These are multiple small calcified granulomas scattered throughout the splenic parenchyma. They are normally in histoplasmosis, TB, and sarcoidosis. This is the normal spleen. Some post-traumatic, there can be rupture. Ruptures can appear as subcapsular collections or hematoma formation, and intraparenchymal lacerations. So this is a perisplenic hematoma, splenic abscess, again abscess. These are hemangiomas, hypervascular structures or hyperechoic area lesions within the spleen. They are 1 to 14% of cases can have hemangiomas. So this is a typical hemangioma. You can see highly vascular tumor, benign tumor. Sometimes lymphangiomas can occur. Lymphangiomas mostly show multicystic appearance within the pancreas. These are big multicystic lesions, then you should suspect lymphangiomas. Most common malignancy is lymphoma. This is a complex solid lesion within the spleen and showing solid cystic content, partially exophatic, infiltrating. And this was later diagnosed to be lymphoma. Various metastases can sometimes occur within the splenic parenchyma, so you should always do a detailed scan and look for small lesions within the splenic parenchyma. This another space-occupying lesion was angiosarcoma of the spleen. This is a rare case, and they are highly aggressive malignancies with a poor prognosis. Patient may come with a palpable abdominal mass, so they become cystic, degenerate. Then they show necrosis and secondary infections can occur. Splenic metastasis. That's all the pathologies in imaging a spleen. Thank you.